While we have covered the area of obstetrician largely, I think we should also touch base upon the issues like cyst, fibroid faced by women, which possibly lead to hysterectomy in few cases. So, do you want to share more information?
Yeah, so as I said initially that there are two broad our parts of any female doctor, like what they call ladies doctor is obstetrician and gynecologist. The gynecology part deals with a non-pregnant woman. We have already touched upon the irregular menses part.
Right.
The commonest reasons which a lady will seek a doctor for gynec complaints is heavy bleeding,
Right.
which is called menorrhagia. There can be pain during the bleeding, which is called dysmenorrhea.
Okay.
There can be frequent menses, means they will get period 2 times in a month,
Right.
called polymenorrhea.
Okay.
There can be, they must be, sometimes they can feel a lump in the abdomen.
Okay.
So when this usually happens typically at the age of 35 onwards, very rarely in a younger age group also. So then when they come to us, we take the history in detail.
Okay.
We do something called a gynec examination, where we do a pulse speculum examination. We see the mouth of the womb, that is called the cervix. A good practice is any sexually active woman above age of 30 or 35 should undergo something called a pap smear or a cytology.
Right.
That is to rule out any future problems of cancer in the cervix.
Right.
We used to do it for all patients in KEM when we underwent our training.
Okay.
Nowadays it is called liquid-based cytology, where a new technique is there and we can find a HPV virus. But the awareness should be there and they should ask for it.
Right.
Nowadays in the corporates where I'm attached, there are health programs wherein the pap smear and a gynec consultation is must,
Okay.
where we counsel them about all these things.
Okay.
That is called, this we see on the pulse speculum examination.
Okay.
We do a bimanual examination where we come to know the uterus size. If there is any pathology we suspect, then we advise them a sonography.
Okay.
Mostly people are having something called a fibroid.
Right.
That are these are the growths in the uterus.
Right.
Fibroids are benign tumors. The uterus muscle has muscle and fibrous tissue. When it arranges in a separate manner and it causes a localized mass, it is called fibroids or leiomyomas. They are
Okay.
soft tissue tumors.
Okay.
Usually benign, very rarely they can become cancerous.
Okay.
There is another problem where patients having severe pain and heavy bleeding. It is called adenomyosis or adenomyoma.
Okay.
This black dots which you can see, that means the endometrium has breached the barrier and gone in the muscle.
Okay.
Now the endometrium lining normally sheds, as I told earlier when I explained menstruation, and
Right.
this comes out.
Right.
Some of this goes through the tubes in the ovaries. You can see it in the ovary also, it deposits.
Yeah.
Now this is also under the influence of the same hormones, and
Okay.
they also bleed each cycle.
Okay.
And that blood accumulates there. And slowly this uterus becomes big in size. They can have a localized tumor called adenomyoma.
Okay.
Or they can have blood collection in the ovaries.
Okay.
The blood contains hemoglobin, which has a pigment. And later on, if it degenerates, it causes hemosiderin, which is like a chocolate color. It's old blood.
Okay.
So that causes chocolate cysts in the ovaries.
Okay.
So this adenomyosis, chocolate cysts are part of a bigger disease called endometriosis, which is somehow increasing in this generation because of the early onset of menses. And retrograde menstruation is one of the theories, and it is causing infertility and pelvic pain.
Okay.
Then there are other types of cysts. Sometimes, as this corpus luteum, if it ruptures over a blood vessel, it can have a hemorrhage, like how we bang our head and we get a bruise. We don't have to treat that. Don't have to do a surgery for that.
Right.
On its own, it goes after a few days. So sometimes that can be a corpus luteal hematoma.
Okay.
But the ovary is supposed to be very small in size. If it increases in weight, sometimes it undergoes torsion or a
Okay.
twist.
Okay.
That is one of the complaints.
Sure.
The ovary itself can have tumors. They can be functional cysts or there can be tumors in the ovary. They are called cyst adenomas, or if they are malignant, they are called cyst adenocarcinomas.
Okay.
Very rarely one can find a dermoid cyst in an ovary. Means that dermoid cyst looks very scary because that particular cyst in the ovary has hair, tooth, some particles of cartilage.
Okay.
That is because ovary is a organ which is causing development of new follicles.
Right.
So it has elements of all the three layers of our body: ectoderm, endoderm, and mesoderm. So that germ cell tumors like dermoid cysts have to be removed. Surgery is very simple.
Right.
For all these patients who come with menstrual complaints and we diagnose, suppose there is no other pathology, we treat them with medical therapy.
Okay.
We give them certain medicines which reduce the amount of blood flow. We can give oral contraceptive pills to regularize the periods. If there is heavy bleeding, then I suggest my patient that they at least do a DNC. Here we dilate the cervix and curate the lining and send it for examination.
Okay.
Rule out something called hyperplasia.
Okay.
Means this endometrium has overgrown. Why it is important? If it is simple hyperplasia, we can give medicines and reverse it. But if it becomes complex, that means the cells become more branched. 25% of them can have cancer in later stage in life.
Okay.
Or if it is atypical, it is already early cancer. So God has given these signals that pap smear one can do, or they have white discharge called leukorrhea.
Right.
For that they approach. We can see some erosion. We can take a biopsy. Our generation, when we started learning something called hysteroscopy. Means there is a scope which we can see inside the cavity of the uterus. This scope is having a light source and a camera, and on a TV screen we can see what is there inside the uterus.
Okay.
So we come to know something like polyps. There's a growth which can come inside. We can come to know whether the hyperplasia is a different type.
Right.
We can remove that polyp and send it for biopsy.
Okay.
And we can diagnose these major problems earlier in life. So if the lady is less than 40 years and if there is no major problem, for the menstrual complaint, we can nowadays put something called a levonorgestrel containing intrauterine device. It secretes the hormones daily, progesterone hormone, and it prevents her excess bleeding, pain during bleeding, or heavy bleeding.
Okay.
So this is a conservative management. But if it is not getting relieved, the final treatment is removal of the womb, which we call a hysterectomy.
Okay.
If there is a fibroid, we remove the fibroid, which is called myomectomy. It is reserved for those women who want to have pregnancy in future.
Okay.
If ovarian cyst has to be removed, we remove only the ovarian cyst in a younger age group girls. In a very elderly patient with ovarian cyst, we remove the entire ovary, which is called oophorectomy.
Okay.
Now, all these surgeries are traditionally done by a open route where we cut like we used to cut for cesarean sections. But since past 3 decades or more, we are approaching all these surgeries by a keyhole surgery route called the laparoscopy route.
Okay.
The advantage is there are only 3 to 4 holes in the abdomen, which are only skin incisions. And from a keyhole, with the help of a laparoscope, which the lay persons wrongly call laser, we can do all these surgeries.
Okay.
The recovery is much faster, and there is no other risk of complications of a laparotomy, like wound infection, prolonged hospital stay, or more pain.
Okay.
In addition, our Indian surgeons, we use the natural orifice route, that is the vaginal route.
Okay.
How it is, the analogy what we can give is how dentists, if they have to do something in the tooth, they do through the oral cavity, the natural route which God has given.
Right.
A surgeon, if patient is having hemorrhoids, approaches to the rectal route.
Okay.
So for gynec problems and the removal of womb, we can approach to the vaginal route where so-called normal delivery occurs or vaginal delivery occurs. Right. It requires a special skill set and training, and luckily our generation has been taught that by our teachers.
Okay.
So that vaginal route is the least invasive route. All over the world, the studies are recorded in something called a Cochrane base, and they have compared and they have found that if a womb can be removed by the vaginal route, that is the best route.
Okay.
Only if it cannot be removed by that route, then one can use the help of keyhole surgery, that is laparoscopy surgery. And in few cases, we have to resort to the abdominal surgery. That is the abdominal hysterectomy. So one need not be dogmatic about the route of surgery,
Okay.
but this should be the approach.
Okay.
And as a gynecologist, one should be able to offer all these three like a cafeteria approach or a menu card. Tell the patient the advantage and disadvantage and let them decide.
Right.
So that is the way how we approach gynec problems.
Okay.